Hello.
Hi, Zach.
Okay, so I am on the computer. I couldn't tell that I was on the computer audio, so I was also dialing in. So I obviously don't want to do that. I I'm not
Yeah,
certain that
whatever you're most
the
comfortable with. Yeah.
so you can hear me.
Yep. I
See,
can hear
I'm
you.
not sure what am I supposed to see on my screen right now.
You should see a slide that says Friday webinar series, how COVID-19 is impacting health and human
Okay,
services.
yeah,
And
I have
then,
that, but I got some message saying that my browser didn't support this or something, and that
oh,
I needed to upgrade it.
well, if you have any problems, you should be able to advance the slides. And Liz, you should be able to advance the slides too.
Okay, so I'm back here now. I signed in differently, and I'm not supposed to open my camera, right?
No.
Okay, even though I put earrings on. So,
How do you advance the slides? You just hit
So
the
you should
arrow
just be able to use the arrows. Yeah.
like that.
And if you aren't, or if when we start, if you guys need some help, you can just say next slide and I can advance them for you.
Okay, so like you'll do that when you go from one participant to another.
Yes.
Like when
And
Liz
so,
ends and to begin, you'll go from Liz to me, and then I can advance them.
yes.
okay,
So
and
if you guys,
we just mute ourselves all the rest of the time.
yes.
We have control over our own mute or non-mute. It's not on you.
Yeah, I can mute you.
Okay, I can do it.
I don't. Where is the mute?
I see one on top where my microphone.
Presenter chat.
Yeah, there should be a little toolbar up at the top of the screen.
I see a share your web.
And when it mutes and unmutes, it talks to you. It says muted.
Well, mine isn't. Oh yeah, sure enough. Okay.
Ed should be on as
Yeah. Can you guys hear me?
Yeah.
Yep.
All right,
Yep.
I'm on.
We can hear you. And thank you to everyone else who has joined the webinar. We are obviously working through some technical challenges. Thank you for your patience, and thank you to our presenters from far and wide for agreeing to present with us this afternoon. So we'll get started in just a few minutes, maybe a couple minutes after 1, just to let people join.
Hey, this is Ed. I just had a question. Is somebody going to advance the slides, or do I do that somehow when it comes to my turn?
So you should be able to, as a presenter, and you can try it right now, you should be able to advance the slides with just the arrows on your keyboard. But if there is a problem, if you want to just say next slide, I'm kind
Sure.
of the backup failsafe, and I can advance them for you.
Okay, that sounds perfect.
Great.
This is Liz. I have another question. Are folks going to have these slides? I put hyperlinks in mine, and we could send something separately, but I just wondered if they would have access to them.
Sure. Yeah. Afterwards, we generally post a recording of the webinar and also all of the slides on our website on communitysolutions.com. So those should be accessible to folks.
Okay.
Hey, Danny, Kelsey's on.
Hey, Kelsey.
Hello, everybody.
So our fantastic presenters are on. Oh, it sounds like Tara's on. So it seems like
Yep, I'm here.
Great. So gang's all here. Maybe wait just a few minutes after 1, and then if you guys want to get started.
How many people do you have sign up?
Let me check the latest numbers.
356 the last time I looked.
Really?
Yeah. So I know the last week when we did this, we had a couple people. We had a bunch of people join right at 1 or between 1 and 1:05 or something like that. So
each one of us should be speaking for like 12 or 13 minutes. So if we're going beyond that, then we're in trouble.
Yes, we will get the cane out and just pull. All
right.
I'm happy I get to practice my comedy stylings. They're not as appreciated in my house.
Hi, everyone. This is Tara Britton with the Center for Community Solutions. We're going to give folks a few more minutes to join. Thank you all for getting on today, and we will get started in just a few minutes.
And just one more message, because there's been a couple of questions. This is Danny Carlson from the Center for Community Solutions. All of the attendees are automatically muted, so you don't have to worry about that. It's just the presenters who need to mute themselves when they're not presenting. So thank you again for those questions in the chat box.
Hi, everyone. This is Tara Britton with the Center for Community Solutions. It's 1 o'clock. I think we can start going through just some of the webinar logistics, if that's okay with you, Danny, since we're at 1 o'clock, and we'll give folks a few more moments to join before we jump into the content. So, Danny, I don't know if you want to lead us off with some of the logistics, and then we'll start on intros.
Sure. My name is Danny Carlson. I am the Director of Communications with the Center for Community Solutions. Basically, how our webinar is going to run today is we will have 3 presenters. Attendees can enter their questions in the attendee chat box. You should be able to see that on the left side of your screen. And I will be curating the questions sort of in real time and giving them to our presenters so then they can answer as many questions as possible at the end of the presentation. But feel free to put all those questions in the chat box as things are going on. And thank you again for all coming, and we hope you enjoy today's presentation. Tara?
Thanks so much, Danny. I'm going to do a quick introduction of the work of the Center for Community Solutions. We're a nonpartisan nonprofit organization that aims to improve health, social, and economic conditions through nonpartisan research, policy analysis, communications, and advocacy. We have several policy priority areas that you can see listed on the slide here. We have really been trying to be as responsive as possible to different policy issues arising as it relates to the COVID-19 pandemic. And we have a whole page dedicated to the work that we've done as it relates to the pandemic and different policy areas. And we've partnered with Advocates for Ohio's Future, which you'll hear about here in a moment, to bring you all information about how the pandemic is impacting various health and human service programs. And so last week we hosted a webinar with guests from Community Catalyst talking about the federal legislation that has been passed in response to the pandemic as it relates to health issues. And so this week we wanted to bring folks to you who could give you an update more on kind of the economic support programs and what that means for everyone as we are in this very unprecedented, strange time period for all of us, I think. So with that, I'll turn it over to Kelsey to let you know about Advocates for Ohio's Future and then do an introduction of our speakers. I just want to thank you all so much for joining today. And you will be able to have access to the slides and the recording after this is over. And then we also just wanted to share, and we'll remind you all at the end of this, that we're going to be sending out a survey to our listserv at Community Solutions as well as Advocates for Ohio's Future within the next week to ask some questions about how different organizations are kind of experiencing the pandemic. So we really think that will be great information to inform our policy recommendations and information that we're sharing with policymakers. We encourage you all to respond to that when you see that in your email. So I will turn it over to Kelsey now. Thank you.
Thanks, Tara. Good afternoon, everyone. My name is Kelsey Berkfeld. I am the Coalition Manager of Advocates for Ohio's Future. We are a nonprofit, nonpartisan coalition of over 500 health and human service organizations across the state, focusing on policy advocacy, research, and as well as some provider organizations as well. Our members range in their specialties from making sure individuals have access to food, safe and affordable housing, access to health care, services for older adults, as well as those with disabilities, as well as ensuring we have a strong early care and childhood education program. So we really work together to make sure that we pose a united front to our state and local elected officials and making sure that we are really promoting those services and budget choices for the state that protect the most vulnerable Ohioans. So we are Also on our website, want to make sure you are aware we have a one-page, kind of one-stop shop resource as far as help if individuals, if you and your family or those that you know in your community are seeking services at this time as far as food assistance or unemployment or compensation and resources. We have that resource on our website that you can take a look at. We wanted to make sure it was easy to access and understand and a wide range of services there. I am very excited to introduce our three presenters for today. We have two national policy experts with us today from the Center on Budget and Policy Priorities. It's a nonpartisan research and policy institute. They pursue federal and state policies designed both to reduce poverty and inequality and restore fiscal responsibility in equitable and effective ways. So from the Center on Budget and Policy Priorities, we have Liz Schott. She's a senior fellow with the Family Income and Support Team at the center, as well as Ed Bolin. He's a senior policy analyst on the Food Assistance team. We are also excited to have our good friend Zach Schiller from Policy Matters Ohio. He is the research director there, and they are also a nonprofit, policy research institute looking to create a more vibrant, equitable, sustainable, and inclusive Ohio through research, strategic communications, coalition building, and policy advocacy. So once again, we are very excited to have our presenters with us today. And Liz, go ahead and kick it off when you're ready.
Okay, this is Liz. Did you want me to just start?
Absolutely.
Okay, so I'm Liz Schott. I work with the Family Income Support Team at the center, and we mainly work on TANF. So what I want to talk about with my time today is how COVID-19 issues affect TANF families. I mean, they affect all families, but specifically the TANF program, what federal law changes have or might happen, state actions, what states are doing all around the country, in what Ohio is or isn't doing in relationship to those, but also TANF recipients and a lot of new TANF applicants because of the increased need. And what do some of these other benefits mean for them, and what would be helpful, useful, needed to help them access them? So first, let me talk about the federal side. The CARES Act, the one that got signed on March 27th, extended the TANF block grant through November of 2020. It was another short-term extension, no changes. So there were no changes in federal law, just the extension of the block grant. There were some changes that were proposed in the House bill, the House Democratic bill, and there are changes that we would like to see in TANF, temporary changes related to specifically to COVID-19 response, suspending sanctions, time limits, child support cooperation requirements, and the penalties that states might face. So those are on the table. They may or may not make it into this package. Now, these are things that would give states more comfort and more space to say, okay, we can do these things. But states can do them now, and many states are, and I'm going to talk about that more further. And HHS has issued guidance giving a broad signal that states will not be penalized. So there may be penalties. They can't change federal law. HHS cannot, as an agency, change federal law, but it can grant broad penalty relief that is in the statute, and they have said they will. So states really already have flexibility. A signal from Congress would help, but it exists now. The other thing that we're really trying, there are many things we're trying to get into the next package, but specifically related to the poorest families, we would like to see some kind of an emergency assistance, where something like the TANF Emergency Fund was during the response to the Great Recession, that gives states some extra TANF money. Because TANF's a block grant, states don't get any extra money, even when need increases, such as now is going to happen. So we would like to see some extra dollars. It doesn't necessarily have to be through the TANF block grant, could be a broader program. It would be better, perhaps, that could serve individuals as well as families with children. So I'm going to move on to state actions and what states can do and are doing to ease specifically enrollment and retention in TANF cash assistance. They have great flexibility. They can ease enrollment. There's no requirements. It's not like SNAP where there's fixed certification periods states have renewal periods, but they can change them, they can lift them, they can roll them out. And waivers are not needed. In fact, waivers are not going to really be available. And many states have taken these actions, extending renewals, suspending work requirements, lifting sanctions, not running time clocks. I'm going to go into a little bit more detail on this. And they've done it in a range of ways. Some states, it's been actually legislative action. In Arizona, for example. In other states, it's executive orders. Sometimes the executive order suspends an existing law or rule. But often states have flexibility within their existing law and rules. So there may be just announcements, guidance, tweets. We have a federal government that operates by tweets, so we're seeing that here too. So what are states doing? Many of them are broadly waiving TANF work requirements, and the HHS guidance certainly signaled and said, this is good cause. What does it mean to tell somebody that they should be going to work when you're under a stay-at-home order? And these are not just the usual suspect states. The slide here, everything that shows up on blue means that it's actually hyperlinked. So when you get these slides, when you download them, you can see some of the actions. And now all of these states have done something. We just happen to have a handy hyperlink for some and not others. But as I said, you've got states like Florida, Georgia, Arizona, Illinois, Iowa, Kentucky. You've got a lot of states in one way or the other. Indiana is suspending its upfront work requirements for applicants. So states are in one way or the other kind of saying either you've got good cause, everybody's got good cause, or good cause should be very broadly construed, or they're simply saying, no, we're suspending requirements and we're suspending programs altogether. And that also means that sanctions are suspended. People should not be cut off or get their benefits reduced for something that they can't do. So, and a number of states' directives have specifically said, restore benefits or raise benefits back up. Washington State, Vermont, Virginia, Iowa. I just saw New York today specifically saying restore benefits, even if don't require that there be a period of compliance because they can't comply if, restore benefits. And what we have seen from Ohio, and I checked again this morning, is it's a pretty weak response here. They're kind of saying it's under review. They acknowledge the federal guidance. They stress, however, that eligibility policies are unchanged. So compared to many other states, Ohio, as a state agency, does not appear to be giving a strong signal. Counties certainly have flexibility, I think, within the state guidance of counties have flexibility to grant good cause, but it's not getting they're not getting a very strong signal from the state. Some of the other actions that states are taking relating to time limits, stopping time limit clocks, suspending time limits, not terminating families, allowing families to come back on even though they had previously reached a time limit and were terminated. And again, I've got a lot of state examples and hyperlinks, and we are tracking all of these examples. We're collecting from what we can find from contacts with advocates, agencies, and the web. So we have a lot more detail about all of this if people want, and that is partly why I put the hyperlinks in. Some states are adding emergency benefits or expanding benefits. New Jersey legislature passed a provision to give essentially double the TANF grant amount for a month in which the agency decides it's specifically to COVID-19 reaction. So that should be an extra and essentially double benefits for selected months. Tennessee's created a new program, emergency cash assistance. These are for families that aren't getting TANF, and they've lost a job, and they can get, depending upon family size, $500, $750, or $1,000 a month for 2 monthly payments. And Ohio has, and you guys may know more, and I'd love to hear from you on it either during the webinar or afterwards. They have released some additional money, I think $10 million. You have the PRC program. It's very flexible, and you guys could be using it. The state just needs to put more money in, free up more money to give counties more ability to do things there. So I do want to take my last few minutes to talk about TANF families. And this would be all families, but particularly TANF families. They should be eligible for these rebates, these $1,200 rebates, $1,200 per adult, $500 per dependent child. And when they get these rebates, they would be excluded as income for federal benefit programs like TANF, SNAP, Medicaid. But if these are not tax filers, and many families on TANF do not file taxes, and they're not required to file taxes, they may have very low income, they may be below the requirement thresholds. TANF benefits don't count and don't need to be reported to IRS. So the real challenge here, and it's not limited to TANF families, but it's limited to many very low income families, is how to connect them to these payments. Because payment, let's say, of $2,200 for a mom and 2 kids is a significant amount of money. So as you know from reading the papers, IRS says they're going to do some kind of a simple form for non-filers, and we're still waiting to see that form and what it's going to look like. But they're going to need to be creative and aggressive outreach efforts, particularly because some of the traditional, tax filing assistance, et cetera, is not going to be looking the same. So I think that service providers and county agencies and advocates have a huge role to play to assist, to inform and assist getting this money into their community. And the other problem here is that to the extent that TANF families are unbanked, and many are, and they won't qualify for direct deposit, that's going to be a delay as well. So finally, I'm going to go very quickly because Zach's going to talk about unemployment. I just want to highlight that when we see TANF applications spiking, that means there's people who used to have some income and now don't. These people should also qualify for unemployment insurance, particularly the expansion pandemic unemployment insurance in the CARES Act. And that picks up self-employed people. It picks up people who maybe don't have the sufficient work history, so normally wouldn't apply. And this could also be current TANF or SNAP recipients. And again, these benefits are much richer, so it's worth some effort to steer families to these programs. Finally, I just want to let you know that again, the Family Income Support Team focuses primarily on cash support. We put out a weekly email. We have additional materials that aren't on the Center on Budget website that are more, technical things. But I also want to direct folks to the Center on Budget COVID-19 page, and that's here too. Okay, I think that's me. So happy to take questions, I think, later. Is that the plan?
Yep, the plan.
Tell me.
The plan was to take them at the end,
Sure.
just so all of our presenters get a chance to get through their material. And to attendees, I am marking down all of your questions and putting them into the presenter chat box so we can hopefully get all of those answered. So our next presenter is Zach Schiller. Zach?
Yes. Great. Well, thanks for the opportunity to be here today and talk a little bit about unemployment, especially since we have, almost 700,000 Ohioans who have filed just in the last 3 weeks. And that's, just an unbelievable number. And so unemployment insurance is very much a key element in what people need today. And thankfully, the federal government has really stepped up with some major improvements. I want to give a little background on what unemployment compensation is now versus what it is in normal times. Usually, you use unemployment compensation to tide people over while somebody's looking for a new job. Today, we're in a very different situation. We want people to stay at home, and so the point of unemployment insurance right now is to replace the wage that they had. It's not just to give them a certain small amount while they're looking for a job. The other thing that I think is different, especially, is that up till now, unemployment compensation has excluded large numbers of workers, and this has been especially true in Ohio, where, believe it or not, you can work 30 hours a week at the minimum wage in Ohio, and you don't qualify because we have such a stringent earnings standard in Ohio. And that means that up until just a couple of months ago, only 1 in 5 unemployed Ohioans actually is getting benefits. The new law is going to allow a lot more people to qualify, which is a good thing, and that's part of what I'm going to go over here. So we started out with Governor DeWine making some changes, first with an executive order in which he got rid of, usually you have to wait a week before you get unemployment benefits, and you also have to search for work while you're looking for a job. And of course, that doesn't make any sense right now. And so that's been waived. He also made it the general responsibility, not that of the individual employer, to pay for the extra benefits that are going out, which also makes sense. Subsequently, what happened is that, as you know, the General Assembly got together quickly and passed a law, House Bill 197, which covered many, many things, but didn't get too much attention. It codified what the governor had previously said. But in addition, it said, and I think this is well worth being aware of, that somebody can get benefits if they're unemployed or unable to work because of the governor's executive order or the health departments or the employers. So this is a very broad language that we're hoping that the state really interprets liberally so that the maximum number of people are eligible for benefits, as they should be. We have yet to learn about some of that. So we have the CARES Act, and it had, I think, 5 different key elements that relate to unemployment compensation. And I'm going to go over the first 3 of those in subsequent slides, but it includes pandemic unemployment compensation. And this is a little bit problematic because we got all these new acronyms and they're very similar to one another. So it's very confusing, and it'd be easy to figure one as the other. But anyway, we have one, which is PUC. This is going to be an extra $600 a week. We've got pandemic unemployment assistance that Liz mentioned earlier, covering new workers. We have an extension of benefits of 13 weeks. And then we have 2 other items which haven't gotten as much attention. One is the federal government will pick up the full cost of benefits in Ohio for work sharing. And that means if an employer feels that instead of, let's say they have 500 workers, instead of laying off 100 of them, they could have everybody work 4 days a week, and then they could get unemployment covering that other day. And Ohio has an existing program for this. And under the CARES Act, the U.S. will pick up the cost. So this is an incentive for employers to not lay people off and instead share the work, which is a great program. It's a voluntary thing that employers can do, and we're hoping that many more of them do. This is on the ODJFS website if you want to learn more about it. Finally, many of us on this call, I'm sure, work for nonprofits or for the government. And unlike the private employers, those employers have a choice of paying out benefits and then reimbursing the state agency for the benefits instead of being taxed. And so there are 1 million workers in Ohio who fall in that category. And so they could get really hit. We know that Goodwill, for instance, has laid off 3,000 people. They're going to take an enormous hit. Well, the federal government is going to pick up half of what their cost would be. Not all, but half. So that's at least, helpful, and it goes so far. So to get into a little bit more detail, the pandemic unemployment compensation is $600 a week, and it goes to basically anybody who is getting unemployment. Even if you were getting just the minimum amount in unemployment benefits, you will also get this $600 a week. This is retroactive to when the bill was, I believe actually it's March 29th, but anyway, the end of March. It goes through the end of July. This is not income for eligibility purposes when it comes to Medicaid or CHIP. So those of you who are interested in the interplay of those programs, that's an important point. We don't have this yet in Ohio. They're working to add it. And I talked with a top JFS person on Wednesday night, and he said he was hoping it was very soon, maybe even next week. However, other states are beginning to do this. New York is paying, Kentucky is paying, California and Massachusetts have announced that they're going to be in the next few days. So Ohio really ought to get on board and start paying this immediately. It will be retroactive, so you won't lose benefits, but nevertheless, we really need to get moving. The second that you may have heard about program under CARES is the Pandemic Unemployment Assistance. And this is what allows many, many people who are not either employees, or perhaps some of them have been misclassified, but nevertheless, if you're self-employed, if you're an independent contractor, if you've exhausted benefits, if you're seeking part-time work, this even includes people who already had a job, but then they couldn't get the job because they had to stay at home. There's a whole reasons. They all relate to not being able to work because of COVID-19. But critically here in Ohio, it means that even if you didn't work the requisite 20 weeks, even if you didn't earn $260 a week, which is the general standard in Ohio, you can qualify for these benefits. And so there are large numbers of workers, many of the restaurant workers who lost their jobs are eligible for PUA assistance. And so this is a critical, important improvement. It calls for up to 39 weeks of benefits. So if you start getting them soon, it could last till the end of the year. It will be a minimum of $189 a week. And this is separate from the $600. The $600 is on top of this. You'll get the benefit that you would have gotten normally under the regular unemployment system, or $189, whichever is more. So you can see that this means that people in this program will effectively get $789 a week once you include it with the other. And that's, a significant amount. Unfortunately, this program is not running yet. It's going to be done in a whole separate way from the existing unemployment system. And I'm sorry to say that Lieutenant Governor Husted told us yesterday that it wouldn't be until mid-May that this program is operating. And while it will also be retroactive, and so that will be helpful, that's really not, that doesn't cut it. We have states that are saying that they are going to be on board this month, some of them even earlier in the month. And if we have to wait till mid-May, then our agency isn't doing what it should. So hopefully they'll get it going sooner than that. I know that it is a big job to create a whole new program, but if other states can do it, surely Ohio can. Then there's this PEUC, the Pandemic Emergency Unemployment Compensation, which provides 13 weeks of additional benefits. That's beyond the 26 weeks that you would normally get. And that too lasts until the end of the year. So these programs are basically great additions to what we had already. However, they're temporary. They last for a very limited period of time. And I'll talk about that a little bit more later. So what are the challenges that we face with this? Well, obviously, as many of you are aware, perhaps quite directly, this system isn't working for many people. We've got giant numbers of people who can't easily get through, who are being told to look at documents that they then can't see. Giant waiting periods. Of course, better to use the website if you can and you have internet access than to do it on the phone. They have hired hundreds and hundreds of new people, brought in retirees, gotten people from other agencies to help out, added computer and server capacity. So hopefully they're beginning to get a handle on it. But let's face it, there's an enormous amount of very legitimate frustration out there. And I think what makes it even worse is I saw a video interview earlier in the week from Director Hall in which she actually misstated this very important fact that I've told you, namely that you don't have to have made the traditional $269 a week or have worked the 20 weeks to qualify for this new type of benefit. And so with even her misstating this, which I was quickly told that no, in fact, you will be eligible under those circumstances, you can see there's an enormous amount of confusion. And so it's going to take a while to sort that out. Finally, there are some people who are left out. There are some people who will not get benefits, or at least we don't know for sure if they're going to get benefits, even with this new PUA program. And that's why we're emphasizing that ODJFS needs to interpret the state law that I mentioned earlier and the federal law broadly so the maximum of workers are able to get benefits. Some of these workers may be friends or relatives of yours. If you're a grocery store worker and you're 65 years old and you have diabetes or heart disease and you're afraid that you may get the virus, it's not clear that you can stay at home and get benefits. That you should be able to. We want to make sure that the state will do that. They can do that. They should do that. So we're hoping that people will tell them that and they'll decide to do so. Okay, we have also some challenges that are not things that are right on the docket at this instant, but are very important on a longer term basis. And if we want to have an unemployment insurance system that really works, that delivers benefits to the people who need it, that critically allow communities, which are the other major beneficiary of unemployment benefits, because they allow people to continue to make purchases, to make their car payments, to keep internet access, to actually not become destitute. What do we have to do? Well, we have to make sure that these eligibility improvements for low-wage, part-time, misclassified, and other workers continue beyond this year period. Some of this can be done and should be done in state legislation. If it isn't done federally, it definitely needs to be. The federal government is going to need to extend the duration of benefits. We know from what happened in the last recession that oftentimes we have long-term unemployment that goes way beyond the time period that there's an official recession. We're going to need more than 39 weeks. And so the federal government's going to have to do that. We're going to need money to administer the system. And finally, we're going to need money. We're going to need to refinance the whole unemployment system. I think, though, that it's a red herring right now to bring up that issue. Ohio has underfunded its unemployment system for the last 40 years. We haven't been solvent by U.S. standards since 1974. Employers have paid inadequate taxes to finance what is at best a average and in some respects below average system that does not generate benefits for many, many low-wage workers as other states do. Critically, when our fund runs out of money, which it will sometime in the next few months because of the enormous number of people who are filing for benefits, we can and will borrow from the United States Treasury. This is guaranteed. It doesn't even require some big policy move. We'll ask for it. We'll get it. People will continue getting their benefits. So while, yes, we do need to come up with a long-term way to finance the system, that's something to be at later. And people should not even be really thinking about it now. So that's all I have to present, but I hope to answer what questions you may have later. And thanks very much for the opportunity.
Great. Thank you so much, Zach. So we are going to move on to our next presenter. Ed, if you want to take over.
Sure thing. Thanks so much for having me here. And I'll start by saying it's in the chat box, but the IRS did just put out its simplified filing form for the stimulus payments. So the link is there. We can send it around to everybody. I took a quick look and it requires name, address, date of birth, social security number. And then if you have it, bank account and routing number, IRS PIN, personal identification number if you have it, driver's license if you have it, and then some information for each child. When I clicked on the form to actually try to fill it out to see what it looked like, I got a completely blank screen. So hopefully a lot of people are getting through, but it's something to take a look at. I'm going to talk about SNAP, though, maybe a few comments about child nutrition and try to weave in a few connections, especially to unemployment programs and how they might interact with SNAP. I'm just going to start by saying what we're seeing out there. as a response to the pandemic, as well as the emerging economic kind of crisis, to be honest, for lots of folks. State options in the SNAP program to get benefits quickly out to people and keep people on the program if they're currently eligible, as well as dealing with the sort of overflow of applications we're starting to see. Some of the issues and challenges that states are facing with that. And then what we need next in a additional response from the Congress, or possibly how far we could push USDA to be responsive to the needs of people in communities throughout the U.S. And then finally, a couple of resources for more information, because things are happening so quickly. So what are we seeing? It will vary by state, but we're largely seeing a lot of folks applying for SNAP benefits now. It sort of mirrors unemployment insurance. People are losing jobs. Their incomes can go from something to zero very quickly. And they might not initially know about SNAP or turn to SNAP, but they soon do. So here's just information from Louisiana, where the state actually was tracking applications, and you can see a spike in the applications. But what's maybe a little more worrisome is the dark color climbing up, which is just unprocessed applications. If you can't process every application every day, then they start to pile up, and that's happening in a number of states. And so that's one of the things we'll talk about responding to. At the same time, of course, agencies are closing down. They're closing their in-person offices, which can make access hard for certain populations, although probably a good public health move. And they're trying to struggle with the fact that sometimes a worker who might work in an office with a certain computer and a certain phone system now might be trying to do things on a clunky old desktop computer in their basement with their own private phone that doesn't have the security systems in place. So adjusting to that is a real struggle for lots of states. And I would imagine in Ohio, given the fact that counties operate SNAP, that could vary from county to county depending on when offices are closing and how much capacity offices have. So we're really seeing a crunch on the system. The good news, I think, is that Congress did step up with some flexibilities and options for states to respond initially just to the emerging pandemic. And the idea, I think, was, let's make sure if people are getting benefits because their incomes are low and they need food assistance, let's keep them on. So states, do everything you can to make sure that people who are currently eligible for SNAP don't get cut off because they didn't turn in a form, or don't get cut off because they missed their interview because they're scrambling to find childcare or adjust their circumstances due to their workplaces changing what they're doing. But also, as the sort of health emergencies prolonged and lots of people are losing jobs and there's sort of a growing unemployment crisis, some of these options are available for states to deal with newly eligible people turning to SNAP for help. So the first sort of step was to maximize benefits for currently existing households. And 49 states have done that, including Ohio. I believe I saw from the center actually today that the state will be maximizing household benefits for all current households in the state. That's like, I think, about 450,000 households. It's $80 million of benefits in people's hands, hopefully this week, and in a subsequent in next month as well. Doesn't help every household on SNAP, because some households are already getting their maximum benefits because they are so poor that they qualify for the most in SNAP benefits. But certainly for all other households, that's a big temporary boost. So good news for Ohio there. Then there was a number of options that the Families First Act, which was passed a few weeks ago now, gave states. I think I lost my slides, but hopefully other people still have them up there. And so what that did was it gave states some flexibilities on the sort of processing side. I think the most important ones are that states could delay certifications. So in SNAP, you have to apply, and then you have to sort of show that you're still eligible and report changes in your household. And that's actually a lot of work for 450,000 households throughout the state of Ohio. And so states have the ability to push off the recertification, which is the sort of look at people who have been receiving benefits for usually about 6 months, and make other delays in sort of verifying and acting on information changes. So my understanding is Ohio has taken advantage of most of those options, and that's good news for clients, for households, because it means they can maintain their access to SNAP during this time, and it should help the state manage its workload, because it's probably struggling to deal with the immense workload in unemployment insurance, and there could be a strain on resources because of that. The Families First Act also suspended the time limit for unemployed workers. For those familiar with SNAP, we call them able-bodied adults without dependents. And those folks are usually limited in their access to SNAP to 3 months over a 3-year period. That was in place in many parts of Ohio, but has, as of April 1st, been suspended. So that means that folks can maintain their access to SNAP because they can't work 20 hours a week. It means newly unemployed childless adults who don't have, not caring for kids in their households, who turn to SNAP will be able to get benefits for as long as the health emergency's in place, and hopefully longer, as we're pushing Congress to extend that for a longer period of time. My understanding is that the state has suspended other work requirements in SNAP through the employment and training program. So that is good news, because it really makes no sense to be forcing people to go out either looking for work or in training programs where they can't keep physical distances as they might need to do. So that's a good thing to see Ohio doing. There's also been reductions in some of the interview and verification requirements. And again, Ohio's taken advantage of those options under the Families First Act to just reduce the burden on individuals, but also on states. I think the hope of all that is that people on SNAP can continue to get SNAP during at least a temporary period of time where they can't boost their income by finding work. And hopefully that will allow the state to deal with any crush of applications as people turn to the Department for Assistance. So some of the challenges, these backlogs as applications pile up, there are challenges in getting through those. For a lot of people applying for SNAP, at least what we're seeing in other states, their income really has gone to zero. And so they have no money. They still have rent. They still may have medical costs. They still have food costs. So they need assistance. And I think one of the good things about SNAP, when it's working well, is it's very quick to get people benefits that they can spend immediately. I'll set aside for the moment the challenges of actually getting to grocery stores and purchasing food the way SNAP is set up to do, given the fact that lots of people are reducing their trips to grocery stores. But it does give people the ability to do so. And so being able to process the applications is really critical. There are some other options that states can take that I don't believe Ohio has, although folks can correct me if I'm wrong, around signatures, right? If you're not in the office or not filing a paper form that you're bringing to the office because you can't, how do you actually sign your application? So states do have some options around that. There can be some technological challenges there, but there's also some ability to waive those technological challenges. And that might be something that Ohio should look to if that's becoming a barrier to processing these things quickly. There's also other things states are asking USDA to let them do, including things like allowing students who were eligible for SNAP because they were working and now are not working keep eligibility. I'm not sure that FNS will allow that now, but that might be something Congress can help make happen. But other states are looking for ways of reducing their workload. Some states are looking at delaying terminating people from SNAP. So in other words, if somebody in fact does become ineligible or doesn't do what they need to do to keep their benefits, the state can delay actually terminating them for a month or two, just given the circumstances everyone's facing. I think another challenge for states is that those maximum benefits that Ohio is now giving households that can get additional benefits up to the maximum allotment, they've only been approved for 2 months. But it's looking more and more like the health emergency will last longer than that. And the Families First Act would allow states to request for more than 2 months. So I think it would be wise for Ohio to be thinking about what will happen in, let's see, it's probably May or June when they would need to re-up for emergency allotments. That might be very critical, especially if parts of the state are still dealing with people having to stay home and not be able to work. Another challenge is the interaction between unemployment insurance benefits and SNAP, especially many of these new programs that we just heard about. Those are tremendous resources for households, typically, and likely most of those new benefits will count as income for a SNAP household. So for instance, somebody getting the additional $600 a week in PUC benefits would have income that would make them ineligible for SNAP. Now that's a lot of income though. So it might make sense for households to apply for that. And that might mean they lose SNAP for a period of time. But it might make sense to have parallel tracks. And part of that's because, as we heard, it sounds like it's taking a long time to process some of the unemployment insurance benefits. Meanwhile, if somebody's currently on SNAP or has already applied for SNAP or is thinking of applying for SNAP, they could get SNAP benefits more quickly to sort of cover them or to help them, because it certainly won't cover all their costs, but help them until these temporary unemployment insurance benefits kick in. So again, I think one of the critical things, especially for community partners, is helping get some of this information out in a way that's understandable for households to make the right decisions for themselves, just given the stresses and the fast moving nature of everything. It's also likely that people might get this additional $600 benefit, or newly eligible folks would get unemployment insurance for a temporary period of time. But then that would come to an end. And when that ends, they might become eligible for SNAP again because their income will drop if they're not able to get work or otherwise replace the income. So finding ways to connect back to SNAP might be an important role for community partners working with the state to make sure that people know that these programs might shift. They need the income probably from either source. They need reduced pathways to that income. So to the degree we can make it clear and easy for them to access that, I think it would be helpful. One of the things the Families First Act did was allow states to do what's called pandemic EBT, and EBT means electronic benefit transfer, and is usually what people are talking about when they're talking about the actual card that people use to purchase SNAP. The SNAP card is an EBT card. So this is a program designed for households where kids were in school and getting free or reduced price meals, or at least eligible for free and reduced price meals in school, but now we're not in school. So with school shut down for weeks now, and some looking at shutdowns for future weeks or months or a full year, those households are seeing a real drop in their food assistance, because they've lost the sometimes 2 meals a day that however many children they have were getting. PEBT is a way to put basically the meal value on the card of a SNAP household, or even if they're not a SNAP household, giving them a card that has that value so the household could purchase food and make it at home while their kids are at home. Even though this was in the Family First Act, just yesterday, the first state got approved for this. It took a long, long time for Food and Nutrition Services, the federal agency, to approve these things. You know, schools have been closed for weeks in some places, and households have really been struggling, especially if they don't have alternative means of getting food through their school districts. So the first state was approved yesterday. That was Michigan. And a bunch of states have requests in, so we're hoping that FNS is hard at work approving more of them. I do not believe Ohio has submitted a request, so that's something to think about. It would be a significant additional resource for low-income households. And then finally, a couple other issues include online purchasing. There's pilot programs that have been in place in a couple of states, and I'm not quite sure what could be done, but some states are requesting to be able to allow individuals to purchase or order food online because of their inability to get to grocery stores or the restricted grocery stores. I think Ohio, states have not raised the basic income level for SNAP. Ohio has not taken that in the past, but it might be something to look for in at least in this emergency. So there's a number of different options that states can do. And I'm happy to follow up with more details about that if needed. I did want to just spend a minute, though, talking about what we still need. And there's an effort to have another stimulus bill come out to address not so much the bailout of big businesses and other entities, but rather low-income and middle-income households. Our push at the center and with our partners at the federal level is to push for a response that really recognizes the length of the economic crisis we're looking at. These temporary unemployment benefits, temporary waivers, or maximum allotments for SNAP are not going to cut it in a few months when people are still out of work or still really trying to rebuild their lives. So we need a response that's more understanding of the longer term benefits. For SNAP, we're looking to boost benefits 15% across the board. That would help all households, including those that are currently at the maximum benefits. It's what was done in the Recovery Act in the recession in 2009 and had a real impact, a measurable impact on the ability of households to actually get food on the table and to maintain a healthy diet. We'd look to suspend the work requirements, time limits during this crisis. We have a few other pieces, but just to put out there, that's not just SNAP. It's, as Liz had mentioned, it's TANF. There's ideas for TANF and the ideas around extending unemployment assistance, expanding access to Medicaid at this critical time, and then fiscal relief for states who are facing crunches on all sides. So I'll just end up with resources. I think it's a link to our the center's coronavirus collection of resources. FNS has a pandemic response where they list the waivers that are available, and you can see where Ohio is in the process of getting approved for those waivers. And then I'll also just shout out to the Center for Community Solutions, who have been putting out good work about the details in Ohio. So it's fast changing, and I encourage people to try to stay up to date. But I'll turn it back to somebody for handling the questions. I know a lot of things have come in, so we'll try to get to as many as we can.
Thank you so much, Ed. And yes, we will. Presenters, if you wouldn't mind muting yourself.
Now we will have, thank you for that. We will have time for a few questions, but those that we aren't able to get to, will email questions to the presenters and ask for feedback, and then try to get as many of those answered as we can, so people can get all of the information. So starting at the top, I believe this one's probably for Liz. How is anyone going to restore benefits to people under sanctions?
Well, that depends upon what your state or county, probably state, controls this policy is. If people are under sanction, are they like closed for 3 months and then they have to do something? I actually don't know off the top of my head the Ohio policy. But if somebody has been closed and has been told they can't get back on until they comply, then it could be a reapplication. If somebody's in reduction or suspense, then it could just be the agency bringing them out of that. Of course, the agency might need to be told to bring them out of that.
Great. And since we're limited on time, I'm going to kind of try to skip to each of our presenters. So this next one, I believe, would be for Zach. For those on SSI, is the pandemic unemployment money excluded as well as the state unemployment compensation, or just the $600 under the CARES Act?
You know, I think I'm going to have to get back to you on that. I don't have the immediate answer, so I'll have to do that.
This is Liz. I can, well, first of all, if you're on SSI, you're probably not in, if you're disabled, you're not able and available for work. So you might not qualify for unemployment insurance. But the $600, because the law specifically excludes for Medicaid and CHIP, that the $600, it sort of suggests that it's not excluded for other programs.
Great. All right. Next question for Ed. You spoke about adolescents and dependents on SNAP, but what about adults on SNAP? If theirs is expiring and they may no longer qualify, will they be disqualified at this time?
I'm not quite sure. I mean, so the state has delayed recertifications for several months, so nobody should be. I mean, I have to think it through, but there should be really no reason for somebody to face a disqualification for at least several months. Adults, in particular, if somebody does find like I don't know, sets up a very lucrative at-home business or something, and their income goes up, and they report that income, and they no longer qualify, the state would have to disqualify somebody, but that doesn't seem to be the likely circumstance. So what they're doing is, by delaying the recertifications, it allows people who might not be able to turn in the recertification or not return in a full one, under normal times, they might lose their benefits because of that. But by delaying this, that shouldn't happen. And I'll just throw out, because I saw it in the questions, the stimulus payments, the rebate payments that you get through the IRS would not count for income and SNAP. So that's different than unemployment insurance. But people should try to get those payments, and it shouldn't affect their SNAP benefits.
Great, thank you. Liz, social service providers are often on lockdown. How do they learn about all of these benefit options?
That's a good question. So, how do they learn? Well, there's going to be I think that a lot of people on this call need to take on that job of sharing materials. Certainly, there's a lot of materials that are going to come out, and we're going to be doing the Center on Budget, a bunch of sort of outreach materials around the $1,200 payment. So I think that everyone's got to be pretty creative in sharing information. While Ed was talking, I did not only check the IRS site, and I did get through, but you had to sign up. So you have to register. So it does have this, but I also tried it on my phone, and I was able to get all the same screens on my phone. So maybe there's going to be helping people, talking to people about this. This is more answering the how do you help people when you're on lockdown. But it may be like walking people through how they can do it on their phone if they don't have access to a computer. I was going to say send them the form, but apparently there is no form. It's online, and that will be quicker, but then that's an access issue.
Great. Zach, another question for you. The Lieutenant Governor yesterday said it would likely be mid-May before PUA applications even began to be accepted. Where can these workers turn for temporary relief, and how can we apply pressure to expedite that process?
Well, I mean, frankly, they're out of luck. I mean, yes, maybe they'll have these rebate checks coming in, which would be helpful. But the state has fallen down, and while it's true that this level of crisis and is not something you can really expect, it's also true that we've underinvested in these systems, and that's a reason why we can't respond as quickly. There really isn't a good answer. I mean, people are very legitimately frustrated, and I can't say, oh, well, here's where you can go to get it dealt with. I think that we need to put pressure on our elected officials and try and get to them to see that it's done as quickly as possible. But there isn't really, I think, a good alternative, frankly. I don't know. Maybe the other panelists have an idea, but I don't. Certainly, we can try and make sure that they're able to take advantage of SNAP if that's available. But I don't see a good immediate alternative. I mean, I think these are really good, important benefits, these unemployment benefits, and it really is very frustrating that it's taking as long for them to get out to people as it is. And that's true across the country, but it does seem to be especially true here in Ohio, unfortunately.
This is Liz again. I agree that people in the meantime, and I think both speakers have said this, should be getting SNAP, but also TANF. You know, if you have kids, get TANF. And Ohio does have this PRC program where counties have a lot of flexibility. And I think that counties could be nimbler if they're in terms of who using that temporarily, 1 or 2 month grants to tide people over until this logjam on getting access to the much more useful unemployment benefit. So I would always just include TANF and particularly PRC in the what could happen first while you're waiting.
Well, and I would add that, you know, Franklin County did that, and they had 4,000 applications and used up their entire allotment in one day. And it just shows you there's an enormous need out there. The state has a TANF surplus, and they need to spend it, and they need to let the counties have that money for PRC and get those payments out to people. So, I mean, that's another thing the state could and should be doing.
And they could do it right away. And that's something they could do right now. They released that 10 million, or they sort of freed it up. They could do more, and that is something that could happen quick. They may tell you it can't, and they may have reasons, but I agree that that's something quick and a little bit local, more nimble.
Great. And then I think this will probably be our last question for Ed. If an employee has symptoms such as a fever but isn't diagnosed with COVID, some employers are requiring employees to quarantine at home for 2 weeks. If they do not have paid time off, are they eligible for unemployment during that 2-week period?
I can answer that. I think the answer is yes, they should be. If their employer is forcing them to stay at home, they should qualify. It isn't directly listed specifically in the list of reasons that I have here, but pretty clearly they're having to stay home for that reason. And I think they should apply, and they're likely to get the benefits. I would also urge that people do apply, and you know, there is going to be a lot of interpretation here. I think that the state, as I understand it anyway, will try and do what it can here. And so you should apply if you have any question. And you know, maybe you won't get it, but you should try.
This is Tara with Community Solutions. I want to thank you all so much for joining today. I want to thank our presenters very much for all of this wonderful information. I know that it's a lot to take in, and I think we're going to, in the coming weeks, be connecting you all directly with some of our state partners on various topic areas where I think now that we have this higher level information about the programs from the federal perspective and learning the intricacies of what's happening with unemployment, we will be connecting with folks at the state in different policy areas that will be able to bring that perspective of how things are really happening in each of these policy areas and places that we all can be pushing for additional change and additional access to programs. So look out for the registration links for those webinars in the coming weeks. Again, I want to thank all of our presenters so much for all of this great information. We have a list of the remaining questions here, and like Danny said, we're going to get those out to the presenters and try to get answers if they're there. If we know the answers, certainly we'll try to shed some light on some of those additional questions. It's always good to have a lot to talk about, and unfortunately we ran out of time to get to all of them today. So thank you all again for joining. We will be sharing everything with you afterward, and have a wonderful weekend.